Broadcasting from the business capital of the world, this is the Podcast Business News Network. Hello, everybody. I am Ross Morasso, and a Happy New Year to you, if I can still say that, a couple weeks into 2023. My guest today, Dr. Brandon Fuller. I've had him on the show before. Fascinating conversations. He's an acupuncturist as well as holistic doctor out of Sarasota, Florida. You can find him at absolute-acupuncture.com. Dr. Brandon, welcome back to the show.
Thank you. Thank you.
You know, your history, you actually started on a much more conventional route. For those of us tuning in for the very first time, give us a little flashback in time of how you landed where you did and where you started at in your medical path.
During my undergrad, my goal was to become a trauma surgeon. That's what I always wanted, and I still love trauma medicine. I feel like that I can do the most good in that sort of field. But one of my teachers, one of my professors, was a medical doctor, but also an acupuncturist, and he said, come and get acupuncture. And one day I finally, after months of him saying, come on, I went, all right, I'll do it. And I fell in love after one treatment. I wanted to know more and went down a rabbit hole, and here we are.
So you're saying you got it done like you were the patient the first time you were exposed to it?
I was the patient the first time I was exposed to it. Yeah.
Now, did you have an injury, or was this just something he wanted you to try out?
It was more just wanted to try out. I was a young individual, fresh in college, so there was a lot of stress, a lot of anxiety, and he goes, I can help you with that. And I went, no, this is a part of life. And after he whittled it down and whittled me down, I kind of went, all right, I'll do it. And after that, I loved it.
Okay, so that's interesting for me. So acupuncture has numerous, I guess, applications then. So you just got it done because you were stressed out.
Right. Yeah, it was all about just helping with stress and anxiety of school, and I was working a full-time job at the same time. So it was, when am I going to have time to sleep and eat and study and work? And so, yeah, the amount of applications that acupuncture has is profound in what we can do.
And how long did that last for you, the anxiety, before you decided to give it another go?
So the treatment lasted, I'd say it lasted about a week. I went about once a week, and it, generally around that week time frame, I went, oh yeah, I could feel it creeping back in, and I'd go in, I'd get another treatment, and I'd feel great again.
Right. So like even like a Xanax or something is only good for what, like a day?
Right. Yeah.
Right. Okay.
Yeah.
And so for an entire week after acupuncture, with you having this high level of stress, and I like the version of your stress for our conversation, because it's a stress we can all relate to. However, I think we can also probably assume that being in the middle of medical school is probably a little step above, of just a
Yep.
pain in the rear boss or something like that.
That's
So
it.
it was once for a week, and it's like what I want to know. Like, did you just sort of feel like you were floating around out there and everything was chill, but without any, actual pills or substances? I mean, that's how it went
Yeah.
for like 5 days.
That's exactly how it went for between 5 and 7 days.
And
It depends on how much stress I had during that time period, but for the most part, I felt, like I was floating on a cloud for about a week.
and does that affect then your sleeping?
Yeah, my sleep improved dramatically, actually. I found that, you know, even though it wasn't as much sleep as I would have liked to have gotten, it was deep sleep. It was, rather than tossing and turning and thinking, oh man, I've got this paper due and I've got to get that done. It was, my head hit the pillow. I was out cold for, 5, 6 hours.
So for those of us that want to, give this a try, like does health insurance, like, what's the current status of, the where we are? Because acupuncture isn't, I mean, we all know what it is now, but this
Right.
wouldn't be a normal repertoire. So can sometimes health insurance actually cover this into 2023?
Yeah, sometimes health insurance can cover it. Generally, health insurance only covers things that have to do with pain, and more often than not, it's back pain and neck pain. But there is a lot of different insurance providers out there that do cover other things like arm pain or knee pain, and it's almost always pain of some sort, though.
Okay. And if it was for pain,
Mhm.
those ones you're ripping off, knees, elbows, back, neck, what sort of relief do you find is, I know everyone's different, but what would be a common result that you would find after someone does one treatment? So let's say I have like a lower back pain, right? There's a biggie for the United States of America. So I do one
Yeah.
treatment versus two versus five versus 10. What sort of progressions do you see in people?
Like you said, everybody's different, but I generally within one treatment we see an improvement of range of motion. It might not be an improvement in the pain level, but generally there's an improvement in range of motion. I had a patient just yesterday who came in with neck pain and severe arthritis degeneration, and she goes, I'm really excited. And I said, why? And she said, I went to physical therapy this morning and they said I can move my neck more than I ever could just from one treatment with you. So, one treatment, generally it's range of motion over pain reduction. As we get further and we do more treatments, generally we see some sort of pain reduction. Now, depending on multiple factors, it could be 50% to 100%, depending on the individual and what damage is done and that sort of thing.
All right. So when you say, at least early on,
Mhm.
not a reduction in pain, but motion. So let's say I had this neck pain, right? And so that's an easy motion for us to figure out, like, how far could I turn to the left or right.
Sure.
So after one, just to make sure I'm clear on what you're saying, I still have this pain, except I can go that extra inch.
Mhm.
Whereas before, like, I would get to that inch, let's say, and for a neck, 1 inch is a lot, right?
Right.
I get to that point and it's just the pain would be excruciating or something that would just completely prevent me to stop
Yeah.
doing it. But you're saying this normal level of pain would be there, but now you get that extra inch in the beginning.
Right. Yeah. Yeah. Absolutely.
Okay, so you do other things too at your practice. I want to talk about that as well.
Sure.
But for an acupuncture treatment, walk us through again, like, what I'm walking into. Is this some sort of rack from the Middle Ages that I have to go subject myself to with a bunch of needles? Like, what are we doing here?
Needles on the floor, you lay down, I step on you type thing. uh, no, no. So you'll come in, and we'll talk for about 5-10 minutes. We might do some orthopedic evaluations, and then we'll get started. We'll have you lay either face down, face up, on your side, depending on what's most comfortable for you. And then we place needles all over the body that are specifically entailed to what's going on with you. So, low back pain, we might put some in ankles, and we might put some in the legs, we might put some in the low back, we might put some kind of mid to upper back. It really depends. And then you rest, you sleep, you meditate, whatever you'd like to do for about 30 minutes, and then I come in. We might do injections, we might do cupping, we might do Theragun. It really depends. It's derived specifically for the individual and what works best for the individual.
Okay, so what do these needles look like?
So they're filiform needles. So they're about the thickness of a cat's whisker. Most patients don't even know that I'm putting them in, or they feel like a little pinch right when I insert, and then they don't feel anything after that. And so most of my patients will fall asleep before I'm even done inserting all the needles.
All right, so I know that these are sort of specific. So you said you sit there for 30 minutes. Would it be 30 minutes after the last needle went in?
30 minutes after the last needle went in.
Okay, and then so for an experienced acupuncturist such as yourself, like let's say it's 50 needles. I don't know. Like let's say that's not the right amount, but generally for let's say it's lower back pain, how long does it take to get all these needles in? Are you just sort of like zap, 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 or is this is each one its own sort of victory?
No, no. So it's pretty quick. More often than not, it takes me between 3 to 5 minutes to put all the needles into somebody.
And how
Uh,
many needles would that roughly be you can do in 5 minutes?
20 to 30.
Okay.
Yeah. So, and they're going, like I said, they're going all over the body. The more experience you get, the more you have a game plan in your head. So you go, okay, I'm going to start at the feet and work my way up, or I'll start at the head and work my way down. So it makes it a little bit quicker, and you get the motion. You've done it thousands and thousands of times getting the needles in. So it really is a quick, easy procedure.
Now, if someone had, multiple areas of pain, can you sometimes, because I realize if I'm face up or face down, right, it might be hard to do lower back versus my knee, if my, right, but depending on where it goes. But point is, or the question is, if I come in with multiple areas of pain, can you manage them sometimes all in the same treatment, or do you generally need to target them and do one time for each?
Like you said, it kind of does vary. So if somebody came in and had shoulder pain that's in the front and low back pain, I can usually target both, but the work that gets done, you might not get needles in the front of your shoulder. I might put needles in the back when you get up from having the needles in. Then we'll do some sort of work or therapy on the front of your shoulder. So I can usually target 2 to 3 areas of pain each treatment.
Okay, so they don't like necessarily with the acupuncture doesn't conflict with the areas then.
Yeah, yeah, no, no, not normally.
Okay, so you also then mentioned that during the treatment that sometimes you do other things. So I've got 30 minutes of after the needles have gone in. Explain to me what cupping is.
So cupping is the use of glass cups. I actually have one right here, so I can show you. So it's the use of a glass kind of jar slash cup, and we take a pair of forceps, a pair of tweezers, cotton ball in them that's been soaked in alcohol. We light it on fire. We take the cotton ball, we swirl it around on the inside real quick, and what that does is it sucks all the oxygen out. And then we place the cup on the back. We take the cotton ball out because that's usually a question, and it creates a suction.
Oh,
That suction causes micro trauma to that area, and increases blood circulation while pulling stagnant blood in the fascia away from the muscle to allow that increase in circulation to penetrate the muscle, bringing that nutrient rich blood flow into the area, helping a person heal.
so who is this like potentially for anybody with some sort of injury or soreness, or are some people better suited for this than others?
Some are better suited than others. So anybody with open wounds, obviously, we're not going to cup over
Mm.
open wound areas. Pregnancy, we tend not to cup on the lower back or over the abdomen because that can cause issues. But for the majority of people, we can do it for just about everyone, and it's safe, it's effective, and it's simple.
And then, like you said, acupuncture is 30 minutes. How long do these cups stay on for?
About 5, 10 minutes.
And then do I then look like that I've been hit by a pro baseball player's pitcher pitch?
Yes. Or an octopus attacked you, one of the two.
So you'll be left with like red marks for a
Yeah,
little while.
usually red marks. Sometimes they'll bruise really, really heavily and they'll be dark purple. It really depends on how much what we call stagnation is there. So how much blood is just stuck and can't and isn't moving the way it should. And so the cupping actually helps get everything moving, get everything flowing.
Interesting. All right. Then you had also talked about injections. So what would you be injecting us with?
Generally, it's a homeopathic. So something like Traumeel, which is anti-inflammatory and anti-edematous. So it gets injected right into the site of pain and helps with that anti-inflammatory aspect, bringing that inflammation down, allowing that nutrition-filled blood flow into the area, and it helps with any swelling. So most people, when we do those injections, will get up off the table and go, "Man, I feel great," right away. There are other injectables like nutritionals, like vitamin B, vitamin D, vitamin C, and they're all intramuscular. So it's not like you're coming in and getting an IV. It's a quick 30-second injection, and then you're on your way. We do different things like what's called dimethyl sulfone, or it's also known as sulfur.
Hmm.
That is a massive anti-inflammatory, almost like a cortisone shot, but without the side effects of bone degradation
Because
for
it's
patients.
non-steroidal.
Right, right.
Now, if
Yeah.
someone's doing the acupuncture, would you just inject this like right in with the needles, or is it just going to a different spot?
Uh, so generally we'll remove all the acupuncture needles
Hmm.
and then we'll locate that spot. A lot of times what I've found over the years is when I remove all the needles, there tends to be one pinpoint area where there's pain left over. So whether it's a really tough muscle that's just going, I just don't want to give up, that's where we'll inject because the acupuncture is going to help relax everything, and patients are going to go, "Oh man, it feels pretty good, and I can move again. Thank you, that's great." And so that injection goes right into that last little bit that might bring all that inflammation back on.
If someone is not local to you, and for those of us who tuned in here somewhere in the middle, I'm talking to Dr. Brandon Fuller, an acupuncturist as well as holistic doctor out of Sarasota, Florida. So for people that are, and they can find you though and get some
Mhm.
information at absolute-acupuncture.com. And for those of us listening who are not local to you, is there any way to screen out a good acupuncturist from a bad? Like, how do we know who we should give a try to?
Um, that's a good question. So generally, overall, we're all taught the same way.
Okay.
Uh, we all have to meet all the standards and be able to do general practice. If if you're looking for pain management,
Hmm.
um, I recommend finding somebody who has experience in sort of treating pain for many years or has gone further and gotten a doctoral degree in pain management, something of that nature. They tend to have a wider variety of abilities at their disposal because they've tried this and they've tried that, and now this is what works best for most patients. So you can always ask, how long have you been in practice? How long, or do you have a specialized degree in this? And then just generalized questions. Have you ever treated back pain
Hmm.
before? Or have you, if you know what your diagnosis is, have you ever treated this before? Many patients that come in, even though they've seen that I've been doing this such a long time, they still ask, have you ever treated spinal stenosis before? Or have you ever treated, a back spasm? I get that one from time to time. And I go, yeah, yeah, I've treated it many times. But so asking those sorts of questions, they might seem silly, but with new practitioners coming out every couple of months, it's some might go, you know what, I've never actually treated that. You're my first patient. You might hear that. So just ask some questions, get to know who you're going to be seeing before you go in and sign up.
Okay, so you mentioned several things there. Is there a like national in the United States anyway, like a national licensing board or a state licensing board to say you're a certified acupuncturist?
There is. So there's a national board that acupuncturists must pass, depending on the state. So states will issue licensing once you've passed your national boards. Um, the national board is a great thing, I think, because it forces students to be well adept in many areas, from Western medicine to Chinese medicine to nutritionals and herbals and those sorts of things. So then once they've passed them all, they go to their state. They say, I passed all my boards. The state goes, great, here's your license. And you get a state license type thing.
All right, so give us the highlights of your resume then.
I started in Victoria, British Columbia. I spent 4 years there in school, treating many different types of things, from food poisoning to shingles to you name it. I probably treated it up there, and then I said it's way too cold. I'm going to Florida. Uh, I because Canada and the U.S. is a little different. I had to complete some more schooling. So in total for my master's, where students in the US have to do 3.5 years, I've done about 5 years of schooling just for my master's. And then after that, I got licensed, opened a practice, and went, I want more education. So I went to Austin, Texas for my doctorate in pain management and the psychology of pain. And I've been treating ever since. All in all, I've been treating patients for approximately almost 17 years now.
Oh, okay. So you've been at it. You've been at it for a minute. I guess that
Yeah.
would have been a quicker question to ask. So 17 years. Okay.
Yeah.
So, well, we still have 5 or 6 minutes left here. You also do as part of your treatments, you offer CBDs.
Mhm.
So, like, what? Are you injecting me? I got pills. Am I smoking reefer in your waiting room? Like, what are you doing?
No. So at my office, they're primarily topical CBDs. I prefer the topicals. They're a great way to reduce localized inflammation. So you come in, you say, my elbow hurts. Let's put a little bit of CBD on that elbow. It's a great way rather than popping a pill. Um, it works really, really well in conjunction with acupuncture.
Mm,
So you come in, my elbow hurts. We'll do a couple of points for that elbow pain. We'll put a little bit of the CBD cream on there, or liniment, whatever it might be. And then we send you on your way, or you can buy some so you have some at home type thing. There is oral capsules that are prescribed out there, and they're highly effective for a lot of people with stress, anxiety, sleep, you name it. Issues with eating. They can help kind of relax the system so that you feel like, oh, hey, I can eat something now.
do you make your
So
own formulas, or do you get? Are there brands out there that you like?
the topicals, I make my own formulas. I mix them with Chinese herbs, and then I whip it all together in a cream and sell it that way. There, when it's orals and somebody's asking about orals, there's a couple of different brands that I like, but they're prescription only. So you have to be a doctor to order them. You can't just go online and find them and order them. And I prefer those because they're what's called third party tested. So they're sent out to labs and made sure that what they say is in there, and there's nothing else. So rather than going to the drugstore and getting the little gummies that say, oh, hey, this is CBD, but it could have other things in it,
Right.
this is just CBD. And I prefer having that.
And you say prescription only. Like, is that like a United States requirement that these things are only by?
It is not. It is not. It's a little unfortunate because when it's not prescription only, that means anybody can make it. You know,
Right.
you can sell it just about anywhere. You could go to the gas station and get CBD gummies.
But these
With
oral pills, though, did you say those were prescription only?
Yeah, the ones that I like to give to patients, those are prescription only. And I like those. It's generally throughout the US, they're prescription only. So you got to go to a natural medicine doctor and they can order it for you. I like those because they're third party tested and I know what's in them.
But that's a pill now, right?
It is. It's a pill, it's an oil, there are topical creams that you can get that are prescription wise as well.
Do you find a difference between topical, which I would say you probably apply directly to the pain site, versus just taking a pill? Like, does our body know where to go, like with the medicine? Is there a difference?
It's there is a difference, right? So a cream is local, whereas a pill or an oil is what we call systemic. So it's going to go throughout the entire body, whether the entire body needs it or not. And that we see often. Let's say, oh, you have back pain, but we're going to give you ibuprofen to treat it. Well, your neck doesn't need the ibuprofen. It's your back that needs it, right? So, but your neck's getting it anyways because it's systemic when you take the pill. So I tend to prefer the creams over a pill, but you never know. Sometimes people come in and they've got all these different symptoms, and you go, you know what? The pill's going to work better than you rubbing a cream on your belly and then on your elbow and then on your neck and then on your knee. You're going to go through cream really quickly at that point.
So it just sort of depends. If I hurt all over, doc, versus I just got a little tennis elbow, could maybe be the difference.
Right, exactly.
All right, before we go, tell everybody where they can find you.
So they could go to my website. It's absolute-acupuncture.com, or they can give me a call, shoot me a text. It's area code 941-500-2767.
Now, are any of these medicines that you use, are they available, the non-prescription ones, are they available directly on your site, or do they need to chat with you first?
They need to at least shoot me a text, give me a call, and then I can explain proper usage and that sort of thing, and then I can just ship it out to them.
Okay, so anywhere in America, you could send these things out to people.
Absolutely.
Good to know. All right, everybody. Dr. Brandon Fuller, thank you again for being with me today. I enjoy our conversations as always. Dr. Brandon Fuller out of Sarasota, Florida. Absolute-acupuncture.com. Give them a look-see. I have a feeling you'll be glad that you did. And I am Ross Morasso, and thank you all for tuning in today. Until next time.
Hi, this is Dr. Brandon Fuller, CEO and founder of Absolute Acupuncture and Stress Relief. If you have questions about how acupuncture or natural medicine can help, please call 941-500-2767 or go to our website. It's www.absolute-acupuncture.com.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.